Do you have dark velvety skin on your face, neck or armpits? If so, you need to be vigilant for diabetes or insulin resistance. But this is not a complete fact. There are so many other reasons that can cause a similar darkening of the skin, and we are going to discuss the causes, and at the end of the video we are also going to discuss how to treat that without any medication. So the first thing is, so what is this darkening on velvety skin that is there on your face, neck and armpit and anywhere where there are skin creases? So technically it is called acanthosis nigricans. Now that's kind of quite a big word, but what it implies is that once there is an insulin resistance and insulin is not allowed to work, the pancreas tends to make more and more of insulin, and insulin is a pro-growth hormone. It tends to stimulate the growth of the skin cells. So where there are, let's say, 2 cells in the skin, they are going to be 8 and 9, and that thickening is going to look like a velvety skin, and it's going to turn dark too. That happens on the face, on the neck, armpits and anywhere where the skin creases are. And there is a similar mechanism with the other causes as well, but I'm just going to go through all of them so that you should be paying attention that it's not just the diabetes or the insulin resistance per se which is causing it. There are so many other reasons which are contributing towards it. And if your glucose number is fine and you consider that there is nothing wrong with me, this is something that you should be paying extreme attention to, that your glucose number may be right, but still you may be having insulin resistance and other reasons that I am going to talk about. The next thing is obesity. Obesity may not be directly leading to a diabetes mellitus always, but it tends to cause insulin resistance. And the insulin resistance will cause all the features that is there in type 2 diabetes mellitus. Along with that, if you are having any hormonal problem like polycystic ovarian disease in which ovaries are full of cyst and there is a resistance to the insulin, in that case, once again the insulin will be made more and there will be thickening of the skin. Hypothyroidism, it has a separate mechanism, but when there is a deficiency of thyroid hormone by any cause, if it's untreated for a longer period of time, the skin tends to get thicker, it gets to lose its luster, the hair tends to go brittle, and there is darkening of the skin on all the places that I have previously mentioned. There is another hormone problem called Cushingoid syndrome. In that, there is excess of cortisol, which is the stress hormone of the body, and that is made so much that there is excessive deposition of fat in your neck region on the back. That is called the buffalo hump. Then there is centripetal obesity. There is increased fat deposition within your tummy, and it's so visible. There is thinning of the peripheral limbs. So you have fat on the central side, but you are thin and lean in terms of muscle mass. So that leads to insulin resistance too, and there is skin change. Some drugs, and obviously the steroid drugs can cause all of them, and the reason is just like the Cushingoid syndrome. If the steroid is made by your hormone producing organs, it is called the Cushingoid syndrome. But if you're taking it for some medical reason, due to any reason, that can also lead to a similar disease. Unfortunately, there is a final cause which is relatively more dangerous, which is cancer or malignancy. Abdominal malignancy, let's say namely the stomach cancer, the intestinal cancer, liver, and even the ovarian cancer, they tend to have an effect that is similar to acanthosis nigricans, and there is darkening and tagging of the skin. And there are a few other things, seborrheic dermatitis, and we can talk about that in a later video, but it can look really similar to the insulin resistance thing. So let's suppose you are with the diagnosis and you know what's the reason behind it, and you're taking the medication, but still the things are not getting better. So what we can do without medicine to cure that? So that's an interesting thing. The first obvious treatment for that is loss of weight. If you don't lose weight, the rest of the things are just useless. Because if you are having obesity and type 2 diabetes mellitus or the insulin resistance, there is one common denominator, and that is your increased weight. For that, a 30 minutes exercise. And what kind of exercise you can do, I have already made a video on that, and you can go through that and just choose a exercise that is suitable for you. You don't have to follow the general public and the mass. Just follow and do the exercise that you feel like that it is good for you. Now the next thing is, if there is a deficiency of vitamin B12, zinc and vitamin E, you should be supplementing that, and along with that omega-3 fatty acids. But it must be supplemented with the help of your physician. If your physician is allowing you to do that, only then you can use it. Because all of the vitamins that I have just narrated, they are anti-inflammatory, they tend to have a good effect, even if you are having a fatty liver and things like that. But they should be used in a cautious way. Too much of everything leads to some problem. So some people are interested in it. What should I apply on it? I don't want to eat any medication. For that, there are so many things that are recommended. There is partially support of some scientific data to do a couple of things, precisely 3 things. Number 1 is apple cider vinegar. You can apply that for 10 minutes while mixed with water, and after a few weeks it has been reported that the skin darkening tends to improve. But with that, weight loss and the rest of things are done first, and only then you can add that if it doesn't work. The next thing that you can do as a home remedy is turmeric with aloe vera, and that can be applied on your dark skin part, and it takes some time, but it has been reported that it works to some extent. And the last thing to apply is lemon with honey. Now the small quantity of lemon with honey, it can be used for application on the acanthosis nigricans. But if you are not losing weight, or the disease is still there, or you are still taking the steroid medication, none of these things are going to work. And finally, what should you eat in a thing like that? If you are taking too much of the sugary food and the processed food, then forget about cure. These things are not going to get better. But if you stop taking the sugary food and you stop taking any processed food too, and you're taking exercise and then applying the things that I have talked to you, then I think you should be getting better in the next 2 to 3 months. I hope this video was helpful. Stay strong, stay healthy and informed, and thank you so much for tuning in.